evening. Welcome to NTV People's Parliament. My name is Betty Mudondo. For those at home, we are coming to you live from the eastern part of Uganda, and we are in Budaka district. Now, Budaka became a district in 2006 on 1st July, and 19 years down the road, we are in Budaka to understand how the community is accessing basic services. We are looking at services that include health, we are looking at education, we are looking at other services that go ahead with infrastructure development, and we have a number of honorable members in the building that have some insights on where Budaka is as a district 19 years later. Thank you so much for being here physically. For those who have come here in person, I really appreciate your presence. And thank you for everyone who is watching at home for making NTV your #1 station. We're going to kick off this segment, and why we are talking about access to social services is because Budaka, like any rural part in Uganda, faces challenges of accessing these services, and some of these may include grants, they may include pension. So these are all services we're going to talk about today. And to open up this segment, I would like to call on to the representative to the COW. He's going to come and take onto the floor to help us understand how the residents of Budaka access basic services, and then also what is not working, what are the challenges that maybe you face as a district in extending these services to the people, and what do you think that people should know about these services? Please, the clerk to council, I welcome you onto the floor of the August House.
Yeah, thank you, honorable members. I am Honorable Koire. Clerk council. Yeah, the social services in Budaka.
Please extend to the microphone.
We have an issues in health. We have a health center for, but you realize that the health center for of Budaka is strategic. It's along the main road, and it serves a number of districts. It serves Kibuku, it serves Taleja. So as the services move closer, we appreciate that there's need to have Budaka Health Center for elevated to a hospital status. We need the numbers. If you visit Budaka Health Center for now, the numbers are overwhelming.
I want the world to hear us here from
Budaka. The
Budaka.
standard of government is that every sub-county should have a health center for 3. On our members in Budaka, we have 4 sub-counties that don't have health center 3s. We have Kamonkoli sub-county, we have Kakoli, Kabuna, and Ikiki. Ladies and gentlemen, health service delivery is very critical. You find people dying of maternal health, you find people dying because of distance to the nearest health facility. It's a health service delivery challenge where government should have a deliberate effort to ensure that the gaps in the health sector are enhanced. Colleagues, the previous person who was the district planner alluded to the issue of the wage bill. Our staffing levels are still low. There must be a deliberate effort to ensure that the staffing of the district are enhanced. The extension staffing levels is low. You realize that a sub-county extension work of a sub-county manages more than one sub-county. So the staffing levels need to be enhanced to ensure that service deliveries are enhanced at least. Then the other areas of works, our road networks have been opened, but you realize that the maintenance is still wanting. We rely on the 1 billion. The 1 billion is still insufficient. Initially, we had the road fund, but the road fund was limited to a few sub-counties. Despite that, we created more sub-counties, and they were gazetted. We have 6 town councils, but it's only 1 town council that benefits from the road fund. We have the town councils of Kachomo, Liama, Kamonkoli, and Ikiki. They have never benefited from the road fund. Their road networks are wanting. It's a service delivery challenge for the farmers to transport their goods from their farmland to the market. Ladies and gentlemen, I'll get back here, but those are the few of the challenges and the service delivery issues that I wish to share with this parliament.
Thank you very much for your submission, Honorable Member. And I'll start right there. He has addressed issues of health and education. At this point, I would like to call the DHO to come and take onto the floor of the August House and help us understand the issue of elevating Budaka Health Center 4, the issue of sub-counties not having health center 3s, what are the challenges? I visited Budaka Health Center 4 myself. I was there. No. Honorable Member, you're protected by me as the Speaker.
Thank you, Honorable Speaker and Honorable Members. I'm also Honorable Dr. Mulwan Elisa, the DHO of Budaka. I would like to begin by telling you that Budaka has 20 administrative units, but we only have 16 health facilities, leaving out to 5 administrative units without any health facility. This one leaves out one which is going to be opened next financial, which is beginning this July. But those are a number of issues of accessibility. The beauty of Budaka is that it is kind of easy to reach, but we have those challenges that some people are unable to access our services. Out of these 16 health facilities, one is Health Center 4, and one is Health Center 2, and then 14 are Health Center 3s. This health center 4, as the representative of House said, it is basically serving as a hospital. When you look at the numbers, unfortunately we didn't prepare the numbers, but when you look at the numbers we are handling, we qualify to be working as a hospital. If I could use an example of maybe the issue of deliveries, in a month we would conduct roughly about 380 deliveries, both cesarean and normal deliveries. When you look at the daily OPD, it's above 150 on a daily basis. That's a higher number. And then the other issue is on the issue of staffing. When we use the current new structure, we are at about 24%. But when you use the old structure, we are at 78%. But that's very low, which means we are overworked. But I want to look at the issue of the underlying problems of Budaka. I know we talked about poverty, but poverty is one of the underlying factors that leads to have the health challenges. But one of the other issues also related to that is the issue of the lack of health-seeking behavior. Most people fall sick, but they want to start home. They want to use Panadol for a while before they go to health facilities. So for us, we're encouraging people to be able to move to facilities so that they can be able to get the right treatment. The other the issue of high fertility rate. On average, a person in Budaka here, the female, is supposed to produce about 7 children. That's on the high side. In fact, in this country, I think we are, Madam Speaker, I think we are the highest.
So people
are very fertile here.
People are so fertile here in Budaka.
Yes.
So it explains the increasing population that was talked about.
Yes. So
and someone called for family planning services. Do you?
Yeah, in fact, I want to talk about that one. On top of that, we need to embrace family planning, but people don't want family planning, both men and women. The men discourage the women to go for family planning, yet this is the only way we can be able to check on this. And this will also reduce on the issue of the bigger families, to be able to see that we have the children or the family members that we can manage.
Honorable members, are we going to do what the DHO is saying, or we are going to listen to the The DHO is saying we embrace family planning, to reduce on the population and the poverty levels. There's another one discouraging another one there. I'm seeing them. They're discouraging each other from taking the family planning. But it's okay. We continue.
Yeah, honorable members, the things I'm telling, these are facts. When you look at our documentation, our best that was here could see that on average, when a mother comes for antenatal, when we are taking this to find out which number of pregnancies is this, average, most of them are either 8, 7, 6. So when you take the average, find that we are at 7, and that's the very high. And the only way to check this is the issue of family planning. I know there are people talk about side effects, but the side effects are manageable, and it's not something we'll be able to begin with. So this is what we need to embrace, and then there are a number of interventions that are put in place that we want people to be able to help us so that we can be able to address the issues.
Okay.
We have the issue of malaria is one of our biggest problems as a district.
What is that?
Malaria.
Yes.
But members are refused to embrace the issue of sleeping under the nets, clearing the breeding sites. So we call upon that. We have the nets. Government gave us the nets, but some people are keeping them for visitors.
How often do you distribute the nets at the DHO's office? When was the recent cycle of distribution, net distribution?
The government gives us a net of mosquito nets to be distributed after every 3 years.
Yes.
But we have the nets at antenatal and at immunization centers. So whoever comes for antenatal first visit, we give a net. When a child comes to immunization, when they complete, we give them an additional, because we assume that the one the mother receives during antenatal, be able to cover during the first year. When the child finishes the immunization, we give another net. Okay. But we embrace people to be able to use the nets. I don't know why the honorable member is laughing, but
honorable member, when you have a submission, you put up your hand. You don't laugh at the DHO's presentation.
Yeah.
You put up your hand and you come onto the floor and express yourself. Honorable is funny. So you find the honorable, they find you funny. But today it's not about fun. Please, you put up your hand and come and express your point.
Yeah, because what I'm presenting, members, these are facts.
And
so
it brings me to a question. I was at the hospital, and yes, like you said, you talked about malaria. I realized also there's a number that most of the children that were in that ward were, they said were anemic.
Yes.
Yes. And this comes, most of them, because of
malaria.
The malaria. And then brings me to my next question. I realized most of them needed blood. They were empty blood sackets, and I was looking at them and thinking, okay, so how do you handle the blood? Do you have a blood bank at the health center, or do you rely on Mbale Regional Referral Hospital?
Yeah, we don't have a blood bank. We rely on Mbale, but on a regular basis, we pick blood from Mbale so that we can be able to give to our patients who need blood. Both the children, the adults, and the mothers will be able to give them. So we pick from Mbale, and the allocation depends on what is in Mbale, but of late, we don't have stockouts of blood. At least when there's a shortage, we should be able to pick from Mbale to see that our patients get blood. So
you have a facility or a way of preserving the blood that you get from...
We have a fridge for blood, so that you can be able to preserve the blood in the fridge at the facility.
Okay. Yes. Also, I wanted to ask about the drug cycles coming through your office. What are the drug cycles in Budaka? Because you say people take Panadol. Maybe they take Panadol because they don't have the drugs. What is the drug cycle? How often are the drugs brought through your office?
Yeah, you're right. We receive supplies from national medical stores, and these supplies come after every 2 months. But as you know, these supplies are not adequate. It runs us for about 3 to 4 weeks. Then after that, we get stockouts. But we have our IPs who supplement us to be able to see that we reduce on the stockouts, especially on the essential supplies.
Okay.
But most of the supplies last for 3 to 4 weeks, then the other may be without. But despite that, at least we're able to see that you let the patients come to the facility, and then we can be able to advise or prescribe and be able to see that they access whatever services can be able to offer, than relying on what they have.
Okay, as we wind up, thank you so much, Honorable Member, for your submission. Please wind up in 1 minute.
Yeah, as I wind up, I talked about malaria being one of our biggest problem, but we also have other issues with sanitation-related diseases. Those are the diarrheal diseases. So we encourage members, let's have the sanitary facilities in our homes, in our institution. Those are the latrines. And see that people also use safe water, clear the breeding site for mosquitoes. And then lastly, let's live a healthy life. For us, we encourage disease prevention and health promotion so that we get a few patients who can offer quality service. So we are looking at, can we drink safe, clean water? Can we dispose the waste in the right place? Can we sleep under the net? Then we can remain with a few who can be able to come to assist, and then we'll live health so that we only manage those the non-communicable diseases.
Thank you. Yeah. Thank you so much. Thank you so much, Honorable Member, for the submissions. For now, NTV People's Parliament takes a break. When we return, we move into lived experiences of other honorable members who are in the House to give us an insight into the education and health sector. Stay tuned for now. Welcome back from that break. You're still watching NTV People's Parliament, and we're in Budaka District. I would like for any honorable member who is here and you face challenges in the health sector and you feel they should be addressed. The leaders are in the building and also the nation will be hearing your submissions. So please take on to the floor of the August House and tell us what is not working, what can we ensure that works, and what is the way forward. When you take on to the floor, you give us a submission, the challenge, and what you think should be done, because I know you know what you want.
Thank you, Honorable Speaker. My name is Namseta Flavia. I'm a councillor from Kadimukoli Sub-County. Our health sector in Budaka, personally, I think we need an affirmative action for our health sector in Budaka. We face a lot of challenges. Personally, I face challenges in health, especially due to the long distances. There was a time I was in labor at night, but we didn't have a health facility by then in our sub-county. So the distance was too long, and reaching there, even the health worker was too tired. They have overworked, and you find, with time we went on to find that even other people, other mothers that were attended to, were not from Budaka district, you see? So, as Budaka district, I think we need an affirmative action in terms of the supplies. Okay. The mama kits, the medicines, the drugs. At times we even reach to a point where we think that our drugs are being taken by our health workers. But when you dig deep into the matter, you find that we share our supplies with people from other districts, and the supplies themselves are not enough. In 2-3 weeks, you've witnessed supplies being brought to the health facility, but after a short period you go, there are no drugs. You think the health workers have taken the drugs, but when you dig deep into the issue, you find that really they have not taken the drugs, but the numbers are too high. So I think as a district, we need an affirmative action. We need more drugs than we are receiving right now. Also, in terms of health centers, the population of Budaka is increasing rapidly. And we have some sub-counties without health centers. I'm really requesting our government to look at Budaka district with mercy and make deliberate appropriations of monies for us to construct new health centers in Budaka. Given the population, given the distances, and given the health problems that we have, the burden onto the existing health facilities is too big. If nothing is done to come to our rescue, sincerely as Budaka, I don't know where we shall end. Finally, I want to stress the issue of family planning. I've attended several sessions on family planning, and indeed, I appreciate. But the approach that is being taken, I think we shall continue with the same trend, because women are targeted in these issues of family planning, and the men are left out. The men are totally not involved. And as women, we really appreciate the burden of having very many children, and we embrace family planning. However, in most cases, we even go for long-term methods. You can opt for tube ligation, for those long-term methods. But if our husbands see that it is now 2-3 years you're not giving birth, they'll marry a young wife and start producing more children. So I think the approach must change and target the men, such that they also embrace the permanent family planning methods
Before you go,
for the men.
Honorable Member, I want to take this opportunity to first sample in the room. Honorable members, I want to see hands who would take permanent family planning for men. Out of the men I have in this building, I have 0. You see?
I think you appreciate my sister, Honorable Speaker. Thank you, Honorable Speaker. I beg to submit set of flags.
Honorable members, the handsome men of Budaka. Let let us be involved. Let us be involved in family planning. And family planning doesn't only mean going for injections. They are going to educate us. The in-charge from the health facility is going to educate us on family planning. There are so many methods. Honorable Member, thank you so much for taking on to the floor. We are discussing matters health, and I would like to hear your submission.
Thank you so much, Madam
In 2
Speaker.
minutes.
I'm Honorable Ali Bashir from Humanity First Uganda. Humanity First Uganda has multiple projects, and some of them fall under health, and we have partnered and worked so much with Budaka Health Center for.
2 minutes only.
Even this year, we are meant to have one medical camp with the hospital, but the Ebola question brought in issues, but we are yet to have it. I will not take much time, but I'm pleading to the government, just like the DHO has said, and the member who has just left, that the facility needs to be elevated to a general hospital. Because whenever we have medical camps there are procedures, because we have doctors, practitioners at a very higher qualified level, in that they always want to conduct all the procedures in the facility. But this year, we had gone an extent of partnering to get 2 hospitals at the same time. That's in Bari Referral and the Budaka. So that alone shows that the facility is not really doing to its best.
Okay.
The previous year when we had the medical camp, because we targeted basically dental, we targeted the rheumatologist and the cardiologist, but when doctors came, they really didn't do to their best. So I call upon the leaders of Budaka district and the central government to listen to the people's tears.
Yes.
And elevate this facility to a general hospital. I submit, Madam Speaker.
That is the point to take home. The residents of Budaka want Budaka Health Center 4 to be elevated to a general hospital. And they're also calling on to supplies, like a cycle of supplies, but adequate supplies. They say that they're feeding into other health centers that come through, and before they know it, they're having a drug stock out. Who are we to talk about health and health center 4 here in our district and don't talk to the in-charge herself? Let me have her take to the floor of the August House, and she's going to clearly tell us how they're handling the doctor-patient ratio at the moment, how they're handling the drug stockouts, and also talk about, yes, I have someone from the health center. Thank you so much, Honorable Member, for coming onto the floor. I actually went to Budaka Health Center 4, and I was very impressed with the NICU. The mothers who give birth to preterm babies. Have you been to the NICU? People who are here, you should go to Budaka and have a visit. I went to the NICU and it was as clean. I met some preterm babies and they were all being taken care of. And there's a chart that shows the number of deaths of children, the ones they've lost, and the survival, and the rates of those that have been actually discharged is way higher. They had like 1 for the other. She'll be here to tell us. So thank you so much for honoring our invite and coming through.
Thank you, Madam Speaker. Dr. Winnie Mutaki is my name. I'm a senior medical superintendent, Budaka Health Center 4. I would give a background of Budaka Health Center 4. Just to add on what DHO has already said, Budaka Health Center 4 is actually the referral site for Budaka district and as well as the neighboring districts. We get referrals from Kibuku, Butebo, as well as Butaleja. And so looking at the staffing level, with the new structure, Budaka Health Center 4 has 55 staff out of 130 staff that we are expected to have on the structure. And just like I said, it stands as 42%. And with the doctors, we have 5 doctors, and the doctor-patient ratio at Budaka Health Center 4 is 1 doctor and about 46,000 patients. That is quite high. And just like DHO said, one of the things that if, for example, we are upgraded to a hospital, this will actually address a number of challenges. And that takes me to the issue of medicines. And I would really appreciate our government. Government has tried. For the last last 2 years, the budget for the medicines increased from 20 million, actually doubled. We are now receiving, every month, we are expected to receive, and we receive medicines worthy 41 million. But even then, it doesn't feel or seem like the budget was increased. And this is just because of the overwhelming numbers of patients that we receive. And I also want to appreciate the government, because one of the honorable members talked about referral. Yes, it's a challenge, but I appreciate, because that could have been some years back, but currently we have an ambulance, and this ambulance picks mainly emergencies and looking at mothers. It picks mothers from lower facilities, down lower health center 3s, and even when we also have a mother to refer, a mother moves in an ambulance from a health center 4 to Mbale Referral Hospital. So I would really say that for the referral system is a bit improved, except that there are some challenges once in a while about fuel. But I appreciate DHO's office, because with the funds that we receive as facilities and DHO's office, we put together to contribute fuel for the ambulance. And also on top of that,
I'm going to give you another minute, please, to wind.
Okay, so on top of that, we've also had support from some of the implementing partners. And so to really summarize about Budaka Health Center 4, there are a number of services that we are offering that ranges from outpatient, we have also inpatients, and even the outpatients, we have special clinics. We offer, we have a sickle cell clinic, we have orthopedic services, that is for bones. We do mental health services, we have sickle cell, nutrition. Then when it comes to inpatient, we have pediatric services at the children, maternate, and in maternate, there are quite a number of services in there, and that's where the NICU, the newborn care unit falls. Some of us may not have known, but there is actually quite a lot that is going on when it comes to babies. You realize that a number of babies are not, actually, they are not being referred to Mbale just because we've been able to support them. It is well equipped, and the only major challenge is staffing. So maternate is maternate with the midwives. We have 9 midwives. And with these 9 midwives, I have about 7 departments. And so that takes me also the issue of one of the honorable member, what she said about midwives
being tired.
Yes, being tired.
Yes.
So it's quite a challenge. And so if I'm to go down to break really the challenge of the midwives, it's...
it delves deep in
yes.
there.
So I believe that if the health facility is upgraded, quite a number of challenges will be sorted.
And I have one question for you. I know with the hospital, we deal with health, we deal with sickness, but we also deal with deaths. How are those handled at the health center? Do we have a mortuary to accommodate in case of, God forbid, a death happens at the hospital?
I would say we have a mortuary, but it's just a room, it can't really do much to support the services. And we also don't have, we have a mortuary, we have a room that we use as a mortuary, but it's not the standard mortuary. And of course, we get challenges. This mortuary serves the whole district, even beyond. So the biggest challenge is we don't have a mortuary attendant, and here you're getting, let's say, bodies, unclaimed bodies. We'll have them in the mortuary, issues of preservation. Given the standard, the state in which it is in, it's really quite challenging.
So we are having a mortuary without a mortuary attendant, because normal human beings can take care of themselves. Now, I don't want to say that we've all understood. So how do you handle this as a facility? And what is the way forward? What is your call to the people in authority?
As a facility, it has, just like I said, it has been quite challenging. However, As a facility, each time we get a dead body, we've sat down, we've agreed, for as long as it comes to my notice that there is a dead body, we have to take it on. We agree that every department, actually, if this time a body is brought, each department will be responsible in terms of treating, because the best treatment is just the use of formalin, preserve it for a few days, but at the end of it all, it will rot and smell, which is quite inconveniencing.
And where are they taken after here?
It depends. If it is been claimed, the relatives will take. If it is unclaimed, town council takes on for burial.
Okay, thank you so much, Honorable Member. Thank you very, very, very much. First of all, I'm going to thank you for bringing to light all the services that are being offered, orthopedic, sickle cell clinic, they're all there. Please, the services are there here at Budaka Health Center 4. You can always go and get to see what's happening at the NICU. I was there myself. But also, we are having a number of challenges. She has talked about doctor-patient ratio, the drug stock out, the mortuary. A mortuary without a mortuary attendant. I can't go deeper than that. Welcome back from that break. You're still watching NTV People's Parliament, and we're in Budaka District. I would like to take on one last Honorable Member on health. Please, sir, come and take the floor, the August House.
Thank you, Right Honorable Speaker, and the House at large.
Yes, please.
Good evening.
Good evening.
My name is Magaja Stephen, Assistant RDC, and I welcome you all to this session. But most importantly, Right Honorable Speaker, I would like to react to two issues raised. The first issue was compensation, right? Normally, when we receive such cases, it is better to recommend to the Office of the President to recommend a quite large number of people, because when you recommend one person, it becomes quite challenging for the presidency to compensate just one person who was victimized by the 86 Bush War. So normally what we do, we advise these people to formulate groups such that we recommend them. But whenever these people come, the main challenge we have here in Budaka is that these people don't normally follow up these issues. But I'm going to take up this issue because normally we do have what we call quarterly reports that we submit to the presidency. And I hope that by doing this, maybe in one way or another, it will help us, at least our people, to gain the compensation they have all been longing for within the district. Thank you.
Thank you so much, Honorable Member. For those who are not here, earlier in the other segment, he's addressing some of the concerns that were raised on security and compensation, and we shall surely be able to fit that in. I would like to have a mother who has delivered from Budaka Health Center 4. What was your experience like? Do we have a mother who has delivered from Budaka Health Center 4? I would like to hear a story. Oh, a father. You could be a father and you took your wife. They've told me the birth rate is high. Fathers, you're here, you've given birth to the fathers. Please come and share your experience with the world. Honorable Member, every time I want to pick on you, you're busy. You're either talking to your neighbor or you have moved. Please come and take to the floor of the August House. Please come, I want to see you give a submission. I promised you since morning. I don't want to be a liar in Parliament. Yes, what you said, the Speaker was also a liar. She came, she never gave me a chance.
I request you to allow me to speak in my mother tongue. Okay. That is Lugwere.
Okay.
Ekyensoka nacho, Madam Speaker, tubere tuli kutumula ku
okubyensoma n'ebyensoma
ebyensoma
ebyo tusooka tutumule ku ebyo
alonjikiriye ensooka enyireke ennyuma ku poverty
mbe tinakuyirikire okuyire ku poverty
oleke enjawo maiso
oyaba omaiso
oleke ndumule ukine kiriwo
kale sebo ne yanzire baba
lwabero olunaku lumo Madam Speaker onaiba wange nalwalisya yalwalisirye omukyala we ng'ali kida omukyala we oyo yali nga yakabyala embyalo 7 nenga okumbyalo 7 abaana 2 niyo abali kuwo olubyalo luno lw'omunaana bandamukirye okutaasako omukyalo oyo tuyiruka ku health center 3 ekameruka tutuuka nti abasawo bankobere nti tumwanywerera neki obulezi mwabeina Budaka kubanga Budaka anu niye omukali ali n'embyalo ambukira embyalo 7 ejyalina okukola niki n'okubyalira n'okukoba nti abyalira edde ku health center 3 eyo batubingireyo tutunywere
ate ano mafunyire obuyambi obabe
kati namuwaire obuyambi ninkwata omukyalo oyo nimuteeka ku piki twala abantu basatu tutuuke Budaka
olina eddakiika mweza
itutuuke Budaka abasawo bali active Budaka nabe bali anti
abasawo bali active Budaka
batukolereku batufiireku ekyo ndowooza ekyo nkiwaire ekyokubiri oleke ndumuleko ku education yona
ate an education inakweta
education
Mr. Mugambe Mary Simon, your hand was up. Please come and take to the floor of the August House.
Madam Speaker, we thank the NTV program to come to this place. Honorable members, it's my privilege, and I encourage each and everyone to educate, to take the responsibility of educating your children. On the side of health, Madam Speaker and honorable members, there is one major problem here on most people. Be educated, be what? But I encourage these people that the major problem, they don't want to go to health centers when they have problems in time. A person only goes to a health center when he or she is totally sick. I'm encouraging medical personnel and the rest to talk to these people or talk to some of us that please make sure that you go and take up how could we call it? Checkups. It's very important. Don't live to see that you are bad off before you do what?
You go to the health center.
You go to the health center. Above all, I thank each and everybody who has participated in this program. It has been really an educative program, and we are seeing the fruits of Bugwere, or some parents of Bugwere, because the Madam Speaker you are seeing here is from my place, our place. She's our what?
The truth shall set you free. Say it because... Thank you so much, Honorable Member. Please can have your seat.
Mary Simon Mugambe. I wish you well.
Thank you so much, Honorable Member. I would like to have a mother who has delivered from Budaka Health Center. For what was your experience like? Do we have a mother who has delivered from Budaka Health Center for? I would like to hear a story. Oh, a father. You could be a father and you took your wife. They've told me the birth rate is high. Fathers, you're here, you've given birth to... The fathers, please come and share your experience with the world. Please come and... What was it like? What were the services like? Were there any challenges? What was good from the hospital? In just 1 minute, if you can help me narrow it down.
Thank you, Madam Speaker. My name is Gadala Duffy, the district councillor representing workers. On my experience with the Budaka Health Center 4, I was there. It was last year in June on 8th. I gave birth to a baby girl. Congratulations to me. But
hey, the men of Budaka, allow me to tell the men of Budaka to clap for you because, like they've said, they're not contributing anywhere to family planning, and you're a mother, you're a symbol of what? Of life. Please,
yes.
Only the men of Budaka.
Please do that. Thank you. And my experience, actually, according to the points that have been mentioned earlier, yes, there are issues of understaffing, because when I went, I went at around 7 in the evening, and I found 2 midwives, those that were leaving, and others were waiting to start their shift. So, of course, there are always many mothers at the facility, and we received 2 midwives that night. I'm telling you, many mothers came in that night, and even if you are a counselor, sometimes you can look at these ones and you'll be like, oh my God, let me leave the bed for her. Because now, there are many, and there are only 2 people attending to them. The other thing is that there are only 2 beds for the mothers in that facility, whereby the many mothers that want to come to the bed, others even end up producing on the bare floor. They tell you to put your cover around you. You give birth from there. So, it is not their problem. It is not the problem of the hospital. It's because there are only 2 beds. That is my point. And there are no other beds that will, remember.
Please come to the floor. Yes, continue this. You're protected under me. Please continue the submission. Don't listen. Only listen to me. Order. Honorable member, please come to the floor as she continues her submission.
So that was my experience with them. But of course, I was successful, and I produced so well thanks to the staff that was there.
So we thank the staff that was there. That
they cared, but the beds were only 2. Thank you.
Now, I want to make a very good point when you're still there.
Yes.
I'm so glad that the DHO is coming after you. Do you know why? No. When we were lowering the microphone, he said you will grow. Now for him, he's also going to grow.
It's okay.
We are going to leave the microphone there. He's going to grow. DHO, please enjoy that microphone. DHO, how is the microphone?
Honorable Speaker, the microphone has grown. Yeah, members, I just wanted to clarify on the issue of the beds. I think the honorable member went to the facility. It's good she said 1 year back, but at least we now have, Dr. 5 delivery beds, including 1 for the disabled people. So even the disabled, we have catered for them. We even have a monitor. We may not only put the BP machine, we just put the monitor on you, and then we're able to take the blood pressure, the pulse, the oxygen levels, so that we make the rightful decision. And then the other issue that at least we have 2 doctors at one point. So that at least when one is on call, for instance now, Dr. Win is here, but there's a doctor at the facility. So if that doctor is tired, for instance, he has been busy, and there's a what we call second on call, they should be able to call him to be able to support. And as I speak now, our referral to Mbala has reduced significantly. And doctor talked about the ambulance. We pick mothers or emergencies without we don't tell them to pay anything for the ambulance. It's totally for free. We look within our internal resources so that we have the field, because the communities we are dealing with, they don't have. Let me use the word, they say that there's poverty. So we don't expect us for money for transport, we just send the ambulance. And lucky enough, the ambulance stays with our driver, so within at most 15 minutes we'll have reached where the patient is. So that's what I just wanted to add on.
Also wind up, because you're the DHO and wanted to wind up this conversation on health. What is the way forward? What do you have a plan? Like, what is the plan what plans are coming through to see that Budaka improves access to health services?
Yeah, thank you, Speaker and honorable members. The number of plans that we have written to, the number of documentation in our plan is to upgrade the Budaka Center. For us, our focus to see that when the Budaka Center is upgraded to hospital, most of the issues will be sorted out. But as we do our yearly planning, we normally inform the ministry on our status and the sub-counties that we need to be upgraded or to be created new facilities, so that we reduce on the issue of the coverage. Then the other one is the issue of the mortuary. I was discussing, I think 2 days back, about the issue of the mortuary. After the coming financial want plan to see that we construct at least a modern mortuary, because what we have is just let me say a room where we keep dead bodies, but we're going to that we're now planning for, so that we can be able to put it in to have a proper mortuary, so that at least the body can stay for some years. Lastly, I want to just encourage maybe 3 things. As I said, the issue of disease, for us, we're focusing on disease prevention and health promotion. We want very few people to fall sick to come to the facilities. So we want people to see that we embrace disease prevention and only look at those which are which were unable to be prevented.
Yeah.
Then the other, let's embrace the issue of family planning. And the others, let's live with the young girls to reduce on the teenage pregnancy. Basically, that's what I wanted to summarize. Thank you.
Thank you very much, Honorable Member. For those that are watching from home, we are coming to you from Budaka District, and we've been discussing the state of health in the district. A number of issues have been raised, but also the health officials themselves have also highlighted on what is the way forward, what they look at in the next few months to come and in the next year to come. Thank you so much for attending this session in person. For all those who are here today, I thank you very, very much. For those watching from home, thank you for being part of this conversation. NTV People's Parliament has been in Budaka District, and the conversation will still continue on our social media platforms. Be part of it, because we could be in your district next time. Thank you so much. Have a good evening.